Teratology and hazards to prenatal development. Teratology is the field that investigates the causes of congenital defects. A teratogen is that which causes birth defects. It comes from the Greek word tera, which means monster. Clusters of hazards to prenatal development. First, we have a prescription and non-prescription drugs. Like for example, antibiotic. It is a prescription drug that can be harmful. And also we have a harmful non-prescription drugs. Like for example, the diet pills, aspirin, and coffee. Remember the thalidomide tragedy in 1961? Many pregnant women took thalidomide. It is a tranquilizer to alleviate their morning sickness that gave rise to several deformed babies. Cocaine exposure during prenatal development is associated with reduced birth weight, length, and head circumference. Next is the psychoactive drugs. Are drugs that act on the nervous system to alter states of consciousness, modify perceptions, and change moods. This includes nicotine, caffeine, and illegal drugs such as marijuana and cocaine. Researchers found that pregnant women who drank more caffeinated coffee were more likely to have preterm deliveries and newborn with lower birth weight compared to their counterparts who did not drink caffeinated coffee, according to Iskanadze at 1999, quoted by Santrok 2002. And according to Olson 2000 and Borges 1996, quoted by Santrok 2002, heavy drinking by pregnant women results fetal alcohol syndrome, which is a cluster of abnormalities that appears in the children of mothers who drink alcohol heavily during pregnancy. These abnormalities include facial deformities and defective limbs, face, and heart. Most of these children are below average in intelligence and some are mentally retarded. Environmental hazards. These include radiation in job sites and X-rays, environmental pollutants, toxic waste, and prolonged exposure to heat in saunas and bathtubs. Research found that chromosomal abnormalities are higher among the offspring of fathers exposed to high levels of radiation in their occupations, according to Skra and Dixon, 1985. Radiation from X-rays also can affect the developing embryo and fetus, with the most dangerous time being the first several weeks after conception, when women do not yet know that they are pregnant, according to Santrok 2002. Researchers also found that toxic waste such as carbon monoxide, mercury, and lead caused defects in animals exposed to high doses. For instance, early exposure to lead affects children's mental development, according to Markowitz 2000, cited by Santrok 2002. The prolonged exposure of pregnant mothers to sauna or hot tubs raises the mother's body temperature, creating fever, endangers the fetus. The high temperature due to fever may interfere with cell division and may cause birth defects or even fetal death if the fever occurs repeatedly for prolonged periods of time. Next is the maternal diseases. First, we have rubella or German measles. In 1964 to 1965, resulted in 30,000 prenatal and neonatal or the newborn deaths and more than 20,000 affected infants who were born with malformations including mental retardation, blindness, deafness, and heart problems. And we have cephalus. Cephalus damages organs after they have formed. These damages include eye lesions, which can cause blindness and skin lesions. When syphilis is present at birth, other problems involving the central nervous system and gastrointestinal tract can develop. About 1/3 of babies delivered through a herpes-infected birth canal die. Another 1/4 become brain damage. Admittedly, more research on the effects of emotional states and stress needs to be conducted for more conclusive findings. AIDS is a sexually transmitted infection that is caused by the human immunodeficiency virus, or HIV, which destroys the body's immune system. A mother can infect her child in 3 ways. First, during the gestation across the placenta. Second, during delivery through contact with maternal blood or fluids. And number 3, the postpartum or the afterbirth through breastfeeding. It is recognized that maternal malnutrition during pregnancy may result to inadequate growth in the fetus. If a fetus does not receive enough nourishment, the rate of the cell division is seriously hampered. An extremely deprived fetus may have 20% fewer brain cells than normal. Folic acid is necessary for pregnant mothers. Folic acid can reduce the risk of having a baby with a serious birth defects of the brain and spinal cord, called the neutral tube. A baby with spina bifida, the most common neutral tube defect, is born with a spine that is not closed. The exposed nerves are damaged, leaving the child with varying degrees or paralysis and sometimes mental retardation. These are the example of open and tedious. First, the anencephaly, encephalocele, and spina bifida. And these are the example of closed enditis. First, we have a myelomeningocele and the tethered cord. And we have also other parental factors. The paternal factors, which is the father's exposure to lead, radiation, certain pesticides, and petrochemicals that may cause abnormalities in sperm that lead to miscarriage or diseases such as childhood cancer. As in the case of the older mothers, older fathers also may place their offspring at risk for certain defects. That's all about the teratology and hazards to prenatal development. Thank you.